We're going to call general government meeting to order at 9:33. Roll call, please.
Fleming.
Here.
Gershenson. Here.
Such a bad
Toth.
Here.
Hoffman.
Here.
Kowal. Kokendorfer.
Here.
Woodward.
Here.
Quarles.
Quarles.
Here. Long.
Here.
You have a quorum.
Okay, we'll stand for Pledge of Allegiance.
Hey, Hollywood.
All right, so I first would like to take a moment of silence for that horrific massacre that occurred in Las Vegas last night. I'm just listening to it on the news,
God,
and
I didn't even know.
It's 50 people fatalities and over 400 people injured now. They said.
At a casino? Or?
No, at the concert that they have in Las Vegas every year. So I'd like to do a moment of silence. It's just terrible. Yeah. So let's do a moment of silence. Okay. I pledge allegiance
To the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, then we need a motion for the previous minutes from September 11th, moved by Commissioner Taub, supported by Commissioner Fleming. All in favor?
Aye.
Opposed? Okay, and then we need a motion to approve the agenda as presented, moved by Commissioner Fleming, supported by Commissioner Taub. All in favor?
Aye.
Aye. Opposed? Okay. Public comment. Do we have any public comment? Okay. Kathy has public comment.
Sorry, I would
No
like
problem.
to introduce to you Susan Harding. Susan Harding
Hi, Susan.
is the CEO of ULSA,
No.
taking Ron Borgesser's place, and
Good.
she's been on the job since last December, but finally is getting someone taking her old job place. She's been there for 20 years. And so I expect you'll be seeing more of her at this meeting, and I just wanted you to know the face. I also want you to know that Susan and I meet regularly, and we're always looking for ways to partner, to leverage resources and programs to better serve the community. So
Welcome.
I'm looking forward to working with Susan.
I know I have big shoes to
You
fill.
do.
Yeah. Committee, so I will do my best, and I apologize that I am just getting around to it now, but I was doing 2 jobs for the last 8 months, so glad to meet you all and looking forward to being part of your meetings.
Good.
Susan.
Welcome.
Welcome.
Any other public comment? All right, seeing none, we'll close public comment. We'll move to the regular agenda. Item 1, Health and Human Services Homeland Security Division Emergency Management Performance Grant Agreement for fiscal year 2017 acceptance. Moved by Commissioner Hoffman, supported by Commissioner Fleming. Good morning.
Good morning, I'm Kathy Forsley, Director of Oakland County Health and Human Services, and to my right is Kevin Scheid, who is the Chief of
Emergency management.
emergency management, but he's from Homeland Security. I didn't know if there was any special programs that you were over. And so Kevin's here to help if you have any specific questions for this grant. Unfortunately, the news from Las Vegas is a sad reminder of the importance of grants like these. This is a very important grant to us. It's designed to support the national preparedness goal of a secure and resilient nation by supporting efforts that are ongoing in Homeland Security. They use these funds for training. They regularly sponsor training courses such as various incident management for local first responders. They also do active shooter training for police and citizen response. And they also do rescue task force response. It also enables us to do tabletops and exercises where we can assist in testing emergency response plans. And then Homeland Security is able to identify gaps and make recommendations for changes to those plans. It also helps them in maintaining an all hazards emergency operations plan, which has just been updated. That's a monumental task for Homeland Security to go through. It's been updated and it is now up for review under the county executive, waiting for his signature, and then it will be filed at the state. And also the hazard mitigation plan, which takes input from our community partners. And that they're in the process of updating right now and have several meetings planned for community input in the near future. So it's $53,504, $947 more than last year, and it does pay for 50% of the manager, Tom Hardisty's salary, and it requires a 50% match by the county.
Okay, good. Commissioner Taub had a question.
I was just delighted, anytime we get a little increase there.
Yeah.
Did we have this in our budget? as part
This
of
is
that?
for 2017, actually. They
Oh.
run really behind.
Yeah, it's
and
all
so-
Oh, my gosh.
October to September's done.
Yeah, we're utilizing it, or we will be, but that's how they operate. Actually, I don't know if this might even be early for them, the way
Oh.
they
My goodness,
they
they're
run.
on the ball. Okay,
Yeah.
thank you, Madam Chair.
Okay, any other questions? All right, seeing none, we'll do roll call on the resolution as presented.
Gershenson,
Yes.
Taub,
Yes.
Hoffman,
Yes.
Kowal,
Yes.
Kokendorfer,
Yes.
Woodward,
Yes.
Quarles,
Yes.
Fleming,
Yes.
Long.
Yes.
Motion carries.
All right, and thank you. The next one is Department of Health and Human Services
Thanks,
Children's
Kevin.
Village Division Child and Adult Care Food Program Grant Acceptance. Would like to move that. We need a motion for that. Moved by Commissioner Woodward, supported by Commissioner Quarles. Good morning.
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 This is a second food reimbursement program that we receive at Children's Village. It comes to us through the Michigan Department of Education. This program is exclusively for our shelter care, which is neglected and abused youth and also status offenders. It provides for free breakfast, lunch, and dinner. We receive the highest amount of reimbursement possible. These meals are reimbursed 7 days a week. The grant amount that we'll receive this year is unknown because it's dependent on the number of meals that we actually will serve. Last year, the cost of our food provisions was $821,296, and this grant reimbursed $81,665.
Okay. Commissioner Taub?
Jody, I have a question for you. Have you heard anything more about putting 17-year-olds back into the system locally rather than, in Children's Village? Is there anything more on that yet?
There's been a lot of discussion, both at the state and locally. I know that we're meeting with Jessica Cooper next week, bringing in someone from out of state to discuss with us the cost of that change, and working with Lynn Sonkis as well in terms of it's very difficult to identify the cost because we don't have the data to show the numbers to know how that would impact us locally. So that's an ongoing discussion and trying to pull together information to provide at the state level for them in their decision making.
So it's a go then, kind of.
We're moving forward. We currently do provide detention, treatment, and shelter care services for 17-year-olds. If they're already in the juvenile system, we'll continue to provide services. The biggest challenge for us will be to expand our programming to keep kids safe while we bring in the older kids on a regular basis for different kinds of charges than what we have now. That'll be our biggest challenge, is just expanding programming, keeping everybody safe.
Definitely.
Thank you, Mayor.
Okay, Commissioner Hoffman?
Did you say the total what we spend is over 800,000?
Yes.
So we get about 10% back.
Yes, the total food cost, though, that we have to report for this grant includes staffing, salaries, fringes. It's not just actual food costs. But the two grants, yes, the reimbursement is strictly for the food.
Where's the rest of the money come from? Just different sources, or?
After we deduct these two meal reimbursement programs, the remaining amount of food costs is $458,000. That comes out of the Children's Village budget, but there's a 50% reimbursement from the state out of the child care fund. So the county Children's Village budget ends up paying about $225,000.
Okay. Thank you.
Okay, any other questions? All right, seeing none, we'll do roll call on the resolution as presented.
Taub,
Yes.
Hoffman,
Yes.
Kowal,
Yes.
Kokendorfer,
Yes.
Woodward,
Yes.
Quarles,
Yes.
Fleming,
Yes.
Gershenson,
Yes.
Long.
Yes.
Motion carries.
Okay, so this is the, number 3 is now the, area of agent. So Department of Health and Human Services, Health Division funding for Area Agency on Aging 1B, Community Living Program Services. Need a motion for that. Yeah, do you have that? Everyone have? Okay, I know, I don't think it is. Okay, a motion for that. Moved by Commissioner Fleming, supported by Commissioner Quarles. Okay, then, I don't know if it's on this, is it on
I
this?
don't-
It's not on mine
You
either.
have to
Do we
pull
have-
it out of it.
It's not on this, cause it was changed, so I think we got it after, but I don't think we need it to amend the agenda, we got it.
You can pull it through the email that I sent you.
Okay, okay. Maybe, but they could, you could go up there. Hey, Jim, Helene's here. You got it?
Hello.
Should do that before, I guess. I was thinking this was it, but this isn't it. Alright, so go to your email. Thank you. Go to the emails I got.
I understand.
There was something. It might be in this, right? Is it in this? No, those are the ladies. You can start with your presentation if you'd like,
Okay,
and
so-
we'll get a copy.
In last year's budget, 2016, 2017, there was money that was allocated to address the wait list for Oakland County vulnerable seniors. Commissioner Gershenson listened to a report from Area Agency on Aging and heard that there were a lot of vulnerable seniors that were on the wait list. So money was put aside, and we are finally in the process of moving forward to address this great need in Oakland County. There have been meetings between people up here, Jerry Poussin, Mike Gingell, Commissioner Gershenson, looking at the Community Living Services Program. We have roughly 106 people that are rated the worst, the most vulnerable, and they have a rating scale from 0 to 5. And the 0, they assess 5 different community type supports. Do you have family support, other things, to categorize these people, and they are the most vulnerable seniors. So what this would be doing is we're moving forward to let the Corporation Council draft a contract on how to receive the money, allocate it for these Community Living Services program, and it will be under the Health and Human Services Department. Kathy Forsley and Jim McGuire are working on the process of how to allocate money for the delivery of these services. Are there questions?
All right.
I have
Let
my
everyone-
experts
everyone-
here.
I can give a few minutes and, look at the resolution, because she sent it email, but some people didn't see it. So I think it's going to finance also.
When we met
This week, correct?
Yeah.
It's going to
Correct.
finance, right? Right. You have to wait if we do that, so
Like we're in school.
there's a one-time funding.
Read your memo. Yeah, ask a question.
So this is one-time funding of $600,000 for going towards a wait list. So that's what it's
to
gonna
address
the wait
people
list
on the wait list, the
Okay,
most
now we have questions. 'Cause
vulnerable.
people have the resolution. Okay, Commissioner Woodward.
Thank you, Madam Chair.
So
So,
it's going to finance
and I think you
tomorrow.
summarized this really well. In terms of total service, the 0 to 5, so 0 most critical, 5 important, but not maybe life-threatening. In total, 0, in total in Oakland County, how many people total right now are kind of in this space?
It's about 400, all categories on the wait list.
Okay.
Of
And-
Oakland County
Oakland-
residents.
Oakland County residents.
400.
Right. And then, so does this address just the priority 0 or prior
Yes.
0, 0, and 1? So this is just the prior 0
Yes.
individuals that get addressed, and how many people is that?
106 as of this morning.
Okay.
And let me clarify,
With prior
once
0
someone comes up on the
bias.
wait list, we do a more in-depth questioning and verifying of eligibility. Not all 106 might meet the criteria. There's no, it's a fruit, no cost to be on the wait list and so forth. So we do find that about 60% have the need as presented on the phone.
Yeah, and I guess just in terms, can you speak a little bit about, like, what are the, I mean, I guess the priorities, but like, what are the services that this would help provide for that 106?
There are 4 primary services that the people that we assist receive. Personal care, which is hands-on aides coming in, helping with bathing, dressing, and so forth. Homemaking, which is light housekeeping, the maintenance of the home in a safe environment. Many of the families or the individuals have families who are involved in their care. Most of them actually have families involved in their care. But we provide a respite service where we'll send somebody in for a day, maybe once a week, every 2 weeks, to give the family caregiver a break, chance to do their grocery shopping or other responsibilities. And then the 4th is personal emergency response devices for very vulnerable individuals. We give them one of those help, I've fallen and I can't get up buttons so that they can, and their family caregivers can feel good that they're safe in their home when they're by themselves. Those are the 4 main services.
Right. And then, I guess, I mean, the bigger question, I know I've brought it up with Commissioner Zach and others, that as the population in Oakland County continues to age and is aging at an exponential rate, baby boomers are all now in senior status and will continue to age, and the need for these types of services are probably only going to grow. So what is the plan? That, I mean, if the 600,000 provide, I mean, keep these folks off the wait list permanently, or does it buy us a year, and then then more people are going to come online, or is there, I mean, a kind of a blend of that? Like, what's the long-term solution to address this?
So let me take a shot at it, and I have my experts around me. So this is not like we're going to clean up a wait list. This is a continuous issue that will only grow as our population ages. So the good news, what I'm hoping is that we're going to reduce the wait list by doing this. And Area Agency on Aging is being very creative and looking ahead at other funding sources that will help address the funding for the wait list. And they've been wonderful advocates with the Silver Key Coalition, lobbying on the state level, addressing it with the governor, saying that we save dollars by keeping people in their homes and preventing them from going into higher levels of care, nursing home, then we spend less money. So they've done a great job getting state funding. And looking at other funding sources, there is a social impact program that they've started called Same Address, which is the ability to purchase, for those that are not vulnerable, that have income, they can purchase services from Area Agency on Aging providers, and profit from that program, when there is profit, will help fund this. I am pleased to report, and I can't tell you more, the Area Agency on Aging Board voted to extend an offer to a new CEO last Friday. And they're in the process of doing that. What I'm excited about, and I was on the CEO search committee, is that this person is coming from the healthcare industry and has looked at the Medicare dual eligibility area. And the whole field talks about we've got to be more savvy about using healthcare, billables, so forth. And he has some ideas about how potentially the Area Agency on Aging can seek some other revenue through some other billable services. And there is an initiative. One of the things that the Area Agency on Aging does so well is some of the education programs on diabetes, on balance, and they are working on offering these programs to Medicare eligible billing clients. So again, trying to bring revenue to support those that don't have revenue. So there's a, we know that we have to sustain, these are invaluable services, and we have to find other ways to continue to fund them.
Okay, Commissioner Woodward, you're all set for now? Okay. Commissioner Taub, I have a list, then Hoffman, then Kokendorfer. Commissioner Taub?
Thank you. Having worked with Medicare and Medicaid for 1 billion years, not quite, but almost pretty close, I know that there are Medicare sources positive for home health care as well as Medicaid sources. You're saying that you're not using those now, Jim?
No, we are using everything that's available to us. What we're doing is becoming eligible to be, and we've tapped into Medicaid. In fact, more than half of our budget comes from Medicaid, keeping nursing home eligibles in home. But we're moving more into, the state is moving most of its human services and health services into managed care models. We're seeing this with the dual eligible program that's happening in various parts of the state, including next door in Macomb County, where the responsibility for health and long-term care is given to a managed care company. And they take coordination of all services. So part of our future is working and having contracts with them. We have contracts with actually 5 health plans in Macomb County to provide what we do, the long-term care side of business, with those providers. That's why the new hire coming from that background from managed care is so important. He'll be an asset to us as we transform ourselves into a healthcare organization. We're also exploring, as under Medicare, there's 2 initiatives. There are some specific services we're eligible to provide, things like nutrition counseling, and we've just hired a nutrition counselor who meets the certification requirements, so we're exploring becoming a Medicaid provider, or Medicare provider, excuse me, which we just presented to our board. We're also working with accountable care organizations, hospital physician groups, whose payment is based on keeping people well, because it's becoming increasing knowledge about social determinants of health. The things that people do or that happen to people in their home affect their health outcomes as much, if not more, than the treatment that they get when they're in the hospital or the doctor's office. And so more organizations are turning us, because our staff and our contractors go into the homes on a regular basis to try to improve behaviors and outcomes. So, for example, we have a contract with McLaren Oakland to start having some of our workers do some of the work, be the eyes and the ears of the healthcare system for what's transpiring in terms of services and care for folks in the home. So we're kind of exploring diversification through all those areas, or those are some of the areas, to try to take what we do best and make it available to health providers who have an interest.
Well, certainly we want to help, and this is part of I understand that last year's budget, but I know that things like personal care and homemaking Medicare takes care of for people who, Medicare or Medicaid, one of the 2, takes care of it for maybe not on a long-term basis, maybe on a short-term basis due to hospitalization, but it is there. So my question to you is are you making sure that grandma has, once she gets out of the hospital, she's used up all that stuff before?
Absolutely, and that's part of our assessment process. That's maybe why, for example, everybody that's on their wait list isn't eligible. We go out there and we find out you're on Medicaid. Medicaid can pay for those services. This program is targeted to the non-Medicaid eligibles, people who aren't low enough income or may have a few $1,000s in the bank that won't qualify for low-income assistance. And they're always the hardest hit financially in our society, because if you're on Medicaid, you can get food stamps and all these other supports. So that's kind of the sweet spot for this program. But that's part of our assessment to screen folks out. Veterans benefits is another thing that we look for in terms of eligibility before we
go ahead and tap on this funding. Okay, thank you, Madam Chair.
That's good. I have Commissioner Hoffman, and then after that, Commissioner Kokendorfer.
Thank you, and I thank everybody who worked on this. I think this is a great program. I think it's admirable to try to keep people in their homes, because I think you live longer, you're healthier. You have a criteria here with 4 items on it. You know, they must need help with 2 or more activities a day, and they have to be at least 75 years or older with cognitive issues. Income requirement 125%. Then it says asset requirement less than $20,000. Is that liquid assets, or you have to comply with all those? It's just liquid assets.
Liquid assets.
Okay, all right. I want to make sure. Thank you.
All set. Commissioner Kolkendorfer?
Thank you, Madam Chair. Again, thank you for the presentation. I just had a quick and detailed finance question, actually. The resolution proposed the money be taken out of the Oakland County Senior Services assigned fund balance. Does anybody know what the restrictions are on that balance? I mean, I know obviously we can use it for this. Does anybody know if there are any other restrictions?
Chris, probably.
It was a,
Sorry.
go ahead. No, it was allocated last year's budget,
Okay,
and so for senior services.
got it.
And the contract that will be developed through Corporation Council, my understanding is will address, you know, those.
Understood. I just want to make sure there weren't any statutory restrictions or anything like that.
No, we did it in Oakland County.
Got it. Thank you.
Okay. Commissioner Gershison?
Is everybody else on?
Yes.
Yeah. Well, I just wanted to thank all three of you for your cooperation in this important issue. It was pretty horrifying to know that Oakland County residents in one of the wealthiest counties in the country were on a wait list and weren't going to receive services that they should. But we should all rest assured this is an ongoing problem. And this is not exactly the the long-term fix we were all looking for. So I want to be sure that the new CEO does keep us in the loop and does report to us on the status and on the status of all the other options that I'm sure they will be exploring. And on a personal note, Jim, I really want to thank you for stepping up. It was a tough shoes for you to fill, and you've really done a great job. And we're grateful for that you were able to give us the time coming out of retirement to lead this, and you've really been extraordinarily patient during this whole political situation, which is a lesson in and of itself, to get this money to area agency. You've walked us through it. You've been really patient, as well as Kathy. We do want to thank you for you stepped into this as well. So thanks, and especially Helene for leading this. Thank you.
Commissioner Zach?
I just want to add everything that you said. I do want to correct you. Jim didn't step out of retirement. He stepped out of his job as Director of Planning and Development into
I thought you were already in Florida.
Vacationing.
He was he had actually.
That was quite short.
We
Okay.
brought him back from his, his month-long vacation. And and I have to tell you, it's been an interesting journey, but the area, every painful moment is greatest learning opportunity. I'm very excited under the guidance of Jim, the board, the board chair. There are some wonderful new hires. There is fund balance right now, a wonderful chief financial officer, financial team. I think that I feel that the next CEO, and Jim said to me, they did accept on Friday, starting
2 weeks.
2 weeks. But we got to give him a little bit of time to get his feet wet. He's on the listening journey, and we definitely will bring him here so that you will get to know him well. I think that he is going to be excellent. And I sat through, I intentionally was part of the CEO search committee, as well as Ron Borgesser, who was another invaluable member of the team, in asking good questions and so forth. There was a great team of people picking this next candidate. So we can look forward to moving forward, and working with Kathy on this has been great. So thank you.
Okay. Commissioner Woodward?
It's not a question. I think it's a comment that needs to be said that I don't know if everyone here knows how this issue kind of came up. It was in a kind of a casual update report that this wait list gets, people discover it. And it's a problem, and I think for all the reasons that Commissioner Gershenson raised, that this is something we have to tackle. But this is great. This gets us through the immediate need. But I really, want to encourage, and everyone who's been working on this, to be bold. This problem is only going to grow huge. And as someone who's know, like my kids will be shoulder with responsibility taking care of all of us around this table. That I mean, now is the time to start figuring out. I mean, 600, 400. I mean, this is a manageable number, but this number is going to double and triple and quadruple in very short order. And I love, I mean, some of the ideas and how, I mean, looking at trying to how to address this and maybe changing the model and all. I mean, that's all important. If we need to inject new resources, we've got to like put it in the context of everything. I mean, this was kind of a response. There's a list, there's a cost, boom, problem addressed, but not problem solved. And I think just that we got to continue to be aware of that and be willing to have that look at these very big numbers and like how are we going to address it, looking at how other communities, other counties are addressing this. And be prepared to have those, I mean, I guess, difficult conversations from a funding perspective, but absolutely essential. I mean, the long-term costs of keeping people in their homes as long as possible. We know the health benefits. We know the cost savings to the institutional health care system. I mean, across the board, I mean, we got to be prepared to invest these resources appropriately, and we just need to know like what's the best mechanisms to know how to do that. So I want to thank you all. I know you guys are tackling this, and but I'm deeply committed to hearing bold ideas. And so to our new CEO who's coming on board, bestow that message.
Okay, Commissioner Taub? Do you have
Yes,
something?
the now therefore being resolved, it says, now therefore be it resolved, at the very bottom of the page, that the Oakland County Board of Commissioners hereby approves community living program services to eliminate the wait list for priority 0 individuals. What does that mean?
Priority 0 are the people who meet those 5 criteria.
Okay, all right, I would like to either amend it now or amend it in finance. I want to make sure that every single person who served is an Oakland County resident. We have 6 or 7 other communities who are part of area agency 1B, and I think it's up to them to step up and do what they can do
Maybe
to
it should
help.
be in the
I
resolution.
absolutely feel very strongly
Yeah,
about that.
she should.
Let me address this. This will be used for Oakland County residents, and I have to tell you, of the other board members, other county, some of them have senior millages. They are putting in more funding than Oakland County is proportionately. I think 68 counties or 63 counties in the state of Michigan have senior millages to fund services.
And you know what?
So I want you to understand that
Yeah, you can have
of the counties that they serve, this will be our residents, but
She can
we
put it-
haven't proportionately funded some of these services like other counties are doing it.
Well, you
Okay,
could,
I'm
Commissioner
not
Taub, you
disagreeing
could
with
put
what
in
you're-
there, you could put
yeah.
in there right there on
After we zero,
the wait list for Oakland County, priority 0 individuals, and we'll probably be fine with
wait list
that.
for Oakland County.
Priority 0 individuals, if you
yeah,
want, and it
Oakland
makes it
County
clear,
residents.
if you'd like to.
It just reads disturbing.
Why?
I know, but,
Oakland County priority 0.
Yeah,
Yeah.
no, I think it should say,
I
or
mean, I get-
residents, okay, then you give a wait list for residents of Oakland County who are, yeah,
Eligible.
priority 0 individual, I don't know. Go ahead and figure out something
well,
English-wise.
we need to, after the words priority 0
I know what you're
individuals,
saying, Dave.
who are residents of Oakland County. Right after that.
Okay, you
who
can
are
put that.
residents of Oakland County. And I
Okay.
mean residents, not people who happen
Okay.
to be in the hospital of Beaumont, but I like Beaumont, okay? Sorry, Dave,
Yeah.
I love it. But who go into Beaumont and they
That-
go to Toledo.
'cause you're
I
rural.
love Beaumont. Why don't I hate? Why do I hate Beaumont?
No.
'Cause it's
But
by
in other
you.
words, I wanna make sure that they are permanent residents of Oakland County. If they happen to come to Beaumont from Toledo or from Ann
She's saying when
Arbor.
they refer from the hospital, they have to be Oakland County, I think she's,
Oh.
you know.
Okay, so now you're starting to like move into a different like area. So
Oh,
what if they're staying at a family member in Oakland County, and they have a Ohio license plate? What I mean, what's your definition of
They're
residency?
Ohio residents, as far as I'm concerned. But anyway, let's just put it in, make it simple and say who are residents of Oakland County. I'd like to
All right,
make
do an
that
amendment.
motion.
Okay, does anyone, amendment, does anyone want to support it? Support it by Commissioner Fleming. Any discussion? So you're putting it after priorities 0 individuals?
Yeah.
Okay.
Who are
Oakland.
residents of, permanent residents of Oakland County.
Uh,
Yeah?
So when do you become a permanent resident?
When you file for your voter registration?
I don't know about that because,
I mean,
well, there's a problem with that in a way that, because if it's your elderly mom coming, I don't know what the limitations is. If you have a relative come and they're gonna stay with you 2 years, but their residency's still in Florida, but you're taking care of your mom, so they get no help.
Right, no, well, but who are residents?
I mean, I think there is problems with that as a health care.
If they're residents of Florida and Oklahoma,
Yeah,
Florida,
yeah.
you won't take them.
Do you want,
don't
Commissioner
you work
Chubb, do you
on
wanna
this?
just do your resolution in finance?
Do it in finance. Just
We do
think
it in
about
finance?
it. Gives you a couple more days.
What?
You wanna do the amendment in finance, so we can see, because I think with changing that permanent stuff, I don't know, when people have relatives come stay with them, it could be for long-term, but their residence is still gonna say a different state. I'm thinking.
We rarely get that circumstance because the people that need that level of care, they're gonna be living in their own home, or they're gonna move into the home of their daughter or son if their son lives in Oakland County. That's the only circumstances if someone
Right.
doesn't live in the county but then is living with their parent, maybe they've still got their home in Macomb County.
Right.
Um,
Yeah.
So
But I
that
will-
could be, I mean, it could be, that comes up, I'm sure of it, it comes up because people take care of their other, their family members from a different county or state. Commissioner Kokendiffer?
I mean, there are probably ways to wordsmith that at the end of the day.
Right.
That addresses these concerns. I mean, there are legal definitions of domicile, right? And that means, domicile means a lot more than, hey, where are you registered to vote? If somebody has lived here
Right.
just with their family for a long enough period of time, 6 to 8 months, they can establish domicile. So, the lawyers can probably craft some sort of language there.
Okay, so we'll just think about it and put it in finance then. All right, so we're back on the resolution. Oh, you gotta withdraw?
Yeah.
Will you withdraw? Withdraw, okay. All right, okay, they're both on finance. Okay, so we're on the regular, or the resolution as it was originally. Now, any other questions? All right, we'll do roll call on the resolution.
Hoffman,
Yes.
Kowal,
Yes.
Kokendorfer,
Yes.
Woodward,
Yes.
Quarles,
Yes.
Fleming,
Yes.
Gershenson,
Yep.
Taub,
Yes.
Long.
Yes,
Motion
and now we need a motion for direct referral to finance. It will go Thursday. So we need a motion for that. Moved by Commissioner Hoffman, supported by Commissioner Quarles. Any discussion? No? Okay, do roll call on that. Voice vote. All in favor?
Aye.
Opposed? Okay. So then it will go on finance, Commissioner Taub. Next, thank you.
Can I add a
Thank
comment?
you.
Yes.
I want to thank you very much for this very generous thing. The impact of this, we know from our studies, are that these people that get served under this program are going to be 5 times less likely to go in a nursing home in the next 2 years. Their family caregivers.
That's good.
A 200% reduction in the number of the family caregivers who say that their responsibility interferes with their ability to work. The people who come off our wait list versus those that stay on actually have longer longevity based on the studies that we've done. So you're literally giving people more days to live, more
Their
days
family
for their
members.
grandchildren to get to know them and so forth. It's a tremendous thing that you're doing. Thank you very much.
Good. Thank you.
If it
Thank
was a
you,
close
Jim.
vote, that would have. Should've known that
Thank
sooner.
you. All right, so now we're on number 4, which is Board of Commissioners, Oakland County Department of Health and Human Services Agency Board appointment. So we had Sherry Ross is on there now, and she's seeking reappointment.
I
Commissioner
move
T-
that we reappoint Sherry Ross.
Okay.
Support.
All right, everyone, okay, there's a motion by Commissioner Taub, supported by Commissioner Quarles to reappoint Sherry Ross. Any discussion? I think their committee's good right now. Yeah, okay. We'll just do roll call, that'll be fast. Roll call to reappoint Sherry Ross to DHS.
Kowal,
Yes.
Kokendorfer,
Yes.
Woodward,
Yes.
Quarles,
Yes.
Fleming,
Yes.
That was fast.
Yep.
Taub,
Yes.
Hoffman,
Yes.
Long.
Yes, that was fast item. All right, next one, this one I'm gonna give to Jamie. Next one, Board of Commissioners Solid Waste Planning Committee appointments. So I'm gonna have Jamie explain. I think we have a sheet in front of us too, don't we?
Yep.
And
Okay.
Jamie,
She did a lot of, she did a
You've
lot
done
of
an
work.
incredible job.
She did, that's why
Jamie,
I'm,
of helping
that's why
us
I'm giving
try
her the
to
credit,
understand
because she
this.
did all that.
And this is fabulous.
Right.
Good.
No, it's committee information right now, but we can do a motion to appoint as we want,
Okay.
go through them. So let's go through them. All right, I'm gonna have Jamie, she did all the work.
In one of the previous emails I sent you, I had mentioned to you each of the categories that are listed, and the names of the individuals that I received applications from, and they also identified that they want reappointment. So for the solid waste industry seats, the top 4, we have Kevin Kendall, John Myers, Michael Sapo, and then the new appointment for that portion of who we have that was recommended in place of Sandy Rosen is Michael Fleming from GFL Environmental USA.
All right, why don't we do one of these at a time? We can do
You
it,
want
see if
it
they
that-
want to do it. Yes, so, you know, could we do it that way?
Why can't we move the whole thing?
Well,
Yeah,
do you
why
want
don't we just
to?
move the whole
I think we have
thing?
empty spots, so don't we, still?
There's not, well,
All right, if we don't have empty spots, okay. But Commissioner Hoffman, you have a question?
Well, I was just gonna say, I don't think there are any empty spots, and these people wanna be reappointed, and the new people want
Okay, so I'll let you
reappointed.
go ahead and go to the
Do
next
it
group
as-
then.
Just do it all at one
All
time.
right, I'll let her continue then. I thought we were doing the individual groups, so we can move the whole sheet.
just one more thing to point out for you, under the environmental interest groups for, Ann Vara's previous seat, Ann Vara had recommended Amanda O'Parker, which you have her application. She had mentioned to me that she's not an Oakland County resident, so she also, from the Clinton River Watershed Council, had somebody else that works there, send their application as well, that is an Oakland County resident. That's why you have 2 applications for that one open seat.
See, that's why I wanted to
So
move the
there's,
first.
there's 2 options there. Amanda's
a
the
little
one who was
complicated.
recommended by Ann,
She said another person.
and, confirmed.
So does it have to be
by
Oakland County
River.
residents? You wanted them to be, the committee wanted them to be.
That information under,
No, not
communication
about
item
it.
C that Chris put together
Yeah.
regarding that.
Right.
Under the solid waste planning committee, it says it's silent as to whether they have to be residents or not.
Right.
Right.
But we,
So,
But you should look at that, because if we want to address that communication piece from Chris, then that, maybe we should address that before we get into all this. I mean, right now, there is no residency requirement.
Right. Commissioner Taub and then
well, in
Hoffman.
talking to other commissioners from other counties, particularly the tri-county area, they don't appoint anybody unless it's mandatory. In other words, somebody from Oakland, someone from Macomb, and someone from whatever. All counties that I know of, and pardon my cold, hope people on television don't get it too, but then I'm going, who knows? When they have a filter, thanks, Chris.
That's funny.
People appoint people from their communities, who live in their counties. So I think it's important, and that's just my personal opinion. I don't have the list also of the other person who lives in Oakland County, is there, rather than Amanda.
that was sent in the email with
Okay.
the applications.
All right, so what is
It
that?
was Matt Einhauser.
And from what group?
Both Amanda
Oh,
and
Clinton
Matt
Water-
are both
River
from Clinton
Waters-
River
oh,
Watershed.
yeah, I
They're
remember
both-
you
they
said
both
that.
are.
And that
One is in
lives where?
Oakland County, his address.
Don't we have that?
It was in the applications, I can
Yeah, I
send
think-
tell you right now.
I mean, if it's Oakland County, that's what we're looking for.
Well,
Yeah.
well, just,
Commissioner Hoffman, then I'll go to Commissioner Woodward.
In this case, I don't think we should rely on the fact that they all live in Oakland County. Now, some of these addresses up here is where they're, like John Myers from Waste Management.
That's his business
That's
address.
their corporate address.
Right.
We don't know where they live, and I don't know that we should care in this instant. These people are all make up this group, and they all have something to contribute. And as far as Ann Vara, I trust her
Right.
recommendation
Oh, is it?
that she made. And so I think in this case, we shouldn't worry that they live in Oakland County.
Okay, I have Commissioner Woodward, then Commissioner Quarles.
thank you. I guess very much in line with Commissioner Hoffman. I mean, I guess, I apologize, I don't have, and for whatever reason, I'm having a hard time pulling it up. I mean, is Amanda the acting director of the Clinton River Watershed? What are their positional places? Because, I mean, obviously, having someone, the senior leadership, the most senior leadership of the Clinton River Watershed, I think, has
Oh, yeah, what's her
potentially has more
position? Yeah, what's her
valuable
position there?
input into these decisions when we're talking about solid waste. And that is clearly the watershed is a large portion of this county. and beyond, and I think that expertise, I mean, for her to have,
Watershed plan.
So, okay, so she's the watershed planner, and she's from Macomb, Harrison Township.
she lives in Macomb.
Yeah.
Okay, so she's the
Harrison
watershed plan. And what is the
Harrison
other?
Township.
Matt Einhauser said he's program coordination, lead on technical field services, assists with stormwater and planning services.
And he lives,
He lives in Oxford.
oh, I'd rather have somebody from
Okay. I'll go to Commissioner Quarles and back to you.
Okay.
Commissioner Woodward, Commissioner Quarles.
Yeah, I
I'm
agree
okay with
with
either one.
my colleagues that I'm okay if the person has a connection to Oakland County. And when I look at connection, that's residency or they work in Oakland County. I don't want to see us get so bogged down in details that we are overlooking some good people who are bringing their talent into our commission by their expertise from what they do for a living to help us in guiding with this. And they just happen to live in the county outside or do not live in the city in Oakland County. So I support the discussion on Oakland County ties, but I'm open to residency or
Did you find his, I have his application right here. Are we looking for that?
See, that's why I was gonna move
I
some of
have
these.
them.
Do you see my
Which
book?
one were you looking
Then we
for?
could have came back for the last one.
Did the committee wanna know where Matt lived, or?
Oh, yeah, no, we have it. Oxford.
Okay.
Oxford. All right, Commissioner Tom, we're looking
I'm
where
not
the,
quite certain where the Clinton River.
we're looking it up. We're looking up.
Watershed is headquartered, but I will tell you, it runs through Oakland and Macomb County. And I sat for 4 years listening to someone from Macomb County, now a state senator, beating the whatever out of Oakland County for causing all the problems the Clinton River has. And so I think that alone makes me want from Oakland County who can balance this out, because we get the brunt of the accusations. We're causing all the problems in Clinton River. In reality.
We're uphill.
All right, so
I
wait,
know.
so the Clinton watershed is located in Rochester, Michigan. Their building,
Okay.
physical building of where they
All
work.
right, so that's why I think.
The address, and the watershed goes to, how many counties? 83? I mean, I think it's Detroit, I mean, the Clinton watershed goes everywhere. 72 communities, 4 counties, it's 760 square miles, it's huge.
That's why I think we need to have somebody representing Oakland County on the board we are appointing.
And 1.5.
The other places are not appointing Oakland County residents. They're appointing people from there, if they have a Clinton water, if they have a solid waste planning thing, I can guarantee you, they're appointing
No,
people
I-
from their counties.
I differ with that. I have a neighbor that sits on two commissions in Macomb County. But she sits there because, and she's entitled to it because of her working for them. So, but I don't care what the other counties are doing.
Right.
I'm looking at.
Do you wanna go through these and go back to that one?
Yeah.
Let's go back to it. Commissioner Hoffman?
I think we have to remember what this committee does.
Nothing. No, I'm just kidding.
Solid waste.
But, I mean, all these people
Yeah, we can
are
say what it
cogs
does,
in the
yes.
wheel, but all the committee does is we monitor and update if necessary and add to
And
the
it might
solid
come.
waste plan.
Right.
For
And
Oakland County.
The Oakland County Solid Waste Plan. But the fact that one person lives somewhere else is not gonna be a hindrance to this committee. And I mean, I sit on the committee. It's a great committee and everybody participates. I mean, you have Kevin Kendall up there from Republic Waste Services. Well, I can guarantee you, he doesn't live in Pontiac. So are we gonna go through and find out where everybody lives and X them off this committee? And they all do a good job,
He lives
you
in
know.
Rochester Hills. There are new applications, I don't know about what's on this sheet,
But all their, but
applications
the
through
way this
Rochester
committee was set up, it's from their work that we're appointing them. It's from their place of employment for this group, because they're solid waste industry. It's from their place of employment, and their employment is in Oakland County. I mean, that's what I'm thinking, that's why this is how this was, that's why they wanted a wide variety of groups on this solid waste committee,
Right. And
is to pull different people.
Right.
I mean,
And I think, I mean, the point when we're talking general public, absolutely, they should all be Oakland County residents,
Right.
general public.
Me too.
But when we're talking, we're trying to
Me
pull
too.
expertise.
Right.
Don't we want the best expertise
Yeah.
to help inform
I agree.
decision-making. I mean, it's like something, I mean, coming into the watershed council, I mean, this is like something, their exclusive existence is to protect the water. And
You have to-
don't we want the best person there to help inform those decisions?
I have Commissioner Kokendorfer first, then Commissioner Gershenson.
Yeah, just quickly throw my 2 cents. I agree with this particular committee, keeping its purpose in mind, its expertise. I agree with Commissioner Quarles. If either they're residents of Oakland County or they work here in Oakland County, I think that should be good enough.
Commissioner Gershenson.
Well, I was just gonna say that, so we don't keep having to have this discussion over and over, I think we need to develop a policy, which Chris offered in his, under Communications C. And I think we should address that once and for all, and have Corporation Counsel look at it, and give us an opinion, and then we're done with it. Because this could go on for every single appointment.
Okay, so we're on, so should we go, let's see, in county government, Bob Hoffman would love to be reappointed. And, and then township government is Robert DePalma, and then you want city government,
City government.
they're
would be
switching.
Stephen Percival, who's now the mayor of Clarkston, and Claire Galed would be now general public. because
So they
she's
wanna
retired.
switch.
That's good.
And then you can say your SEMCOG, who's Devin,
Was recommended for Devin Rossdorfer for SEMCOG.
and then Ed was on
Ed-
it before, right?
Ed, stated to me that he would like reappointment, but he has not sent in his application.
All right, see, so
at
that
this
one we
point,
can't
but
do.
he's told me that he wanted reappointed.
So we can't really vote for him till you get the application, right?
Well,
I don't know.
Or can we?
I think that's up to you.
He said he wanted to be?
He told
might
me.
be too big, okay, we could probably reappoint him. If he doesn't want him, we could come back and put someone. Yeah, he does. And then general public is the switch in Chester and Mary Ann, we're already on it. Okay, discussion with the whole sheet. Does anyone? Commissioner Fleming.
Yeah, I would support the whole sheet, including Amanda Parker for Fenton River Watershed. I would have to defer to Commissioner Hoffman, who sits on this
Right.
board and knows how it works and knows how the people work. And I don't think it's a really big deal in this situation, so I would support the sheet exactly as amended and read here. And thank you, Jamie, for doing that.
Yeah, Jamie did a good job. And then Commissioner Woodward supports it. Okay, any discussion? No, she's just gonna be, she's gonna be quiet. I thought she was gonna say something.
Call for a vote.
All right, roll call, roll call on the solid waste planning committee appointments, reappointments and appointments.
Okay. Kowal,
Yes.
Kokendorfer,
Yes.
Woodward,
Yes.
Quarles,
Yes.
Fleming,
Yes.
Gershenson. Yep. Taub,
No.
Hoffman,
Yes.
Long.
Yes.
Motion carries.
Okay. All right. Thank you. Thank you, Jamie, for all your work on that. That was very nice in sending us all their applications, email and stuff. Now we have Kathy Forsley for Department of Health and Human Services Water Programs presentation. Let's see if I can get it going here. And then we need voice vote for these. See the final. Good. We don't have to do those.
Morning again.
Morning.
Okay.
So we've been talking a lot lately about water quality programs, and recently got water quality programming through a Board of Commissioners resolution at the last board meeting. And so this presentation originally was to help you with some decision making, but now I think it's still important to give it to you to help you understand the breadth of the programming in the health division that is really designed specifically to protect the water, surface water and groundwater in Oakland County. So just briefly, the health division has a team or has a unit called Environmental Health Services. Within that, of course, you know we have one team, which we call the food team, which is specifically dedicated and everything they do surrounds food safety, food inspections, food safety education, certification classes, and on it goes. And then we have another team called our Land and Water team. And the Land and Water team, primarily almost every program under them is designed specifically to protect water. But it does it in a variety of ways that you may not know about. So today I hope that you will take away from some things you've never knew before about those programs. So within the Land and Water programs, we have permit programs, monitoring programs, and then we have a really specialized coordination between Environmental Health Services and our Health Education Unit, where they provide notification to the public and posting under certain circumstances to let the public know what's going on with water. So when we look at the permit programs, we are authorized by the Oakland County Sanitary Code as well as state laws. And under the permitting programs, environmental health issues well construction permits, well abandonment permits, on-site septic installation permits, which includes residential on-site septic, commercial, and community. For the purposes of today's discussion, I really won't talk much about commercial or community installations. We work, you should know, we work closely with the state in both of those types of installations because they are very complex, very large, and sometimes require state permits as well. So under well construction permits are something that the numbers have been pretty stable. And if we look at the average over the past 4 years, we've given over 800 well construction permits per year. And this includes new construction, replacement construction, irrigation wells, type 2 wells, which I'll talk more about in a minute. I think it's important you understand what type 2 is, and test wells for new developments that we oversee that when we're doing platting of new subdivisions. We hadn't done any of that work for years, and now we're doing that work again, and that means the economy's improving. And then the other types of wells I'll get into in a minute. I want you to know that when we do a well construction permit, we do a minimum of 3 site visits. We go out initially and we make sure that the location of this well is going in a safe place. It has adequate isolation from contamination. And we also have an online viewer for well drillers who need to drill an emergency well over a weekend. If someone runs out of water and the well driller really wants to help them get back up and running sooner rather than later, we don't want them to have to wait till Monday to apply for a permit. So we provide them online all of the tools that we have in terms of being able to see areas of contamination, buffer zones that have been drawn, and then a well driller knows, oh, if that home is in one of those areas, it's going to need very specific instructions for location as well as the type of construction that has to happen. So generally, if it's in one of those areas, they will wait till Monday and contact us. Otherwise, they have adequate information that tells them I'm nowhere near contamination, I can drill. They do drill, they still apply online, and we catch up with them on Monday and go out and visit them. The other kind of inspection we do during the permitting process is we make random visits. No other county in the state of Michigan makes those visits the way Oakland County does. We have found it's important for us to be on site while they're drilling so that we can make sure that it's being installed correctly, they're using the right kind of grout. We just want to be on site to make sure that everything is happening the way it should. It's to the homeowner's benefit, and it's to the long-term longevity of that well. It's a benefit that we're there working with the well driller. The state requires us to go out 10% of the time to observe what's happening on site. We're pretty close to 100%. We do our level best to get out there and make sure we're observing what's going on. And then we do a final inspection where we go out after the well's all done, hooked up. We'll go out there and make sure that, you know, the well's capped off properly, there's screening in place so bugs can't get into casing and contaminate the aquifer. We'll go into the home, make sure that there's a sample tap in the right location, and then finally, we'll take samples to make sure that their water supply is safe and ready to use. So we spend a lot of time with every single well that's installed. There are other types of, as you can see here, other types of well permits. Geothermal permits. Oakland County was the first county in the state of Michigan to identify geothermal wells as important and needing to have a permitting process, so we put that into place. And I don't know if you're aware of what a geothermal well is, but it's a well that's driven to assist the home with heating the home. And so sometimes those are open loop that actually draw water out of the ground, and sometimes they're not. Sometimes they're closed loops, but still chemicals run through those closed loops, and we want to make sure that the construction is adequate. So we go through the same permitting process. You should know we spend a lot of time on some of those big projects. One that I'm aware of that happened in Troy, they had 75 holes drilled for the geothermal well. So that project, we had someone on site for weeks. Another type of well permit is dewatering. Dewatering is very important for construction to lower the groundwater level. It creates a cone of depression around it. And our sanitarians take a look. We hope to get this information before a project starts, but unfortunately it's after a project starts. But we look around it to see what wells might be affected by this cone of depression. Wells run out of water. We also want to make sure where are there plumes of contamination that might be moved by this large volume of water that's pulled out of the ground to lower the water table. And then we can give the project manager a heads up if we think that there could be problems. We'll go back to the drawing board with them to see if there's a different way that the project could be managed, not to impact wells, not to move contamination. A well abandonment permit is free at Oakland County because we want to encourage people to abandon their wells properly. If there's a water main extension and people are connecting to a municipal supply, we really don't want them hanging on to that well for an irrigation well or just sit there idle. And the reason for that is they are opportunities for potential contamination. Things can run down the casing and into the aquifer over a period of time. These wells tend to be ignored, not maintained, and we want to get them out of service and properly abandoned every chance we get. So if they have a replacement well or a water main extension, we work hard to get that homeowner to consider abandoning their well. On-site septic installations, you wouldn't think it, but Oakland County has one of the largest numbers of on-site septic in anywhere in the state of Michigan. Same with wells, for that matter. People think of us as an urban community, but we have a lot of folks that depend on on-site services for their home. And as you can see here, our 4-year average is about 757 permits per year, and that doesn't sound like a lot, but I want you to know that the majority of our permits that are issued these days have to be engineered. They are very complicated. The land that's left to be developed primarily is land with high water tables, and we need to make sure that no contamination enters that water table. And those that are being replaced that are on lakes with very tiny lots that were originally built as cottages, and over the years until recently, our policies were that if you had an on-site septic system, you were allowed to put an equivalent replacement in. Well, oftentimes, and you know firsthand, there are problems with isolation from neighboring wells, and we're doing our level best as time goes on to get everybody up to code, even if they're replacing. And sometimes it means having to drill wells deeper that are on site that were drilled years ago. to try to get this isolation. If we can't get it laterally, we have to get it in depth. So we're trying to get those wells down into aquifers that are better protected. So as you can see, we spend a lot of time working to really try to make the best of bad situations sometimes. And then the other type of, and you should know we also respond to complaints to eliminate failing septic systems, which also leads to having to do replacement systems. We have monitoring programs. We have a long-term monitoring program, a surface water monitoring program, which is our beach program, and then complaint-generated monitoring. Now, in terms of our long-term monitoring, we average about 1,000 samples from over 400 properties per year in this program. This program identifies areas of contamination, working with the state, which are normally things like lust sites or industrial releases or landfills. Those are our primary concerns. Sometimes they're gas stations, old gas stations that have been abandoned. But these have resulted in known points of contamination, so we monitor the wells of individuals that live near them. And over time, we identify these buffer areas that I was talking about, where we may have hits in our samples of contamination, but it maybe doesn't exceed the maximum contaminant level. So it's still deemed safe to drink. There's a minute trace of something there, and we monitor it carefully to see if it's going up, if the plume is moving. And based on this information, sometimes we're able to work with the state to get funding for water main extensions so that these people can be put on municipal water. Sometimes we work with the state to get the people bottled water in the instances where they're waiting to see if they can get a water main extension. And other times, it's just making sure the plume of contamination hasn't impacted their aquifer, and we continue to keep our eye on it. We provide the most samples to the State of Michigan Laboratory for this program than any other county in the state. And as I said, this creates these buffer zones which now well drillers have access to. So a lot of great things has come out of this program. From time to time, we hear that the federal funding for this program will dry up. So far, we've been lucky and been able to continue this sampling project, but this is something that's always a constant concern for us. Surface water monitoring. Again, this is our beach program, and as some of you may or may not know, we average about 75 to 100 beaches per year that we sample. We do every single public beach every year, but we rotate through the semi-privates or the semi-publics, depending on how you look at it, beaches. Those are the ones that are usually behind locked gates, and we work with associations on that. And we rotate those through on a 3 to 5 year basis. And that's dependent on number of student sanitarians we're able to hire, and dependent on ability for our laboratory to manage what number of samples. So, but that has been the way it's been for the past probably decade. That's how 3 to 5 years is where we've fallen for the rotation. However, should there be a beach that's problematic, we don't rotate them out. We will revisit them the next year. Oftentimes, beaches have problems because they have overgrowth of weeds, or they have overgrowth of cattails or phragmites around the beach. And so there's not good movement of water in that area. We educate the association or the public beach to tell them that this is impacting it and what can they do about it. The other problem, and it's probably more of a problem than anything else, is the state of the beach. Believe it or not, the most contamination that ends up in the water from the beach is from the beach. And every time there's a rain event, everything on that sand washes into the water. This is why it's so important for beaches to have programs where you see them raking the beach, or they're turning it under. They're not just doing it to make it look good, they're doing it because when they turn it over, the sunlight plays a very important role in killing the bacteria that resides in that sand that then will contaminate the beach.
I didn't either, it's really make it.
So
See, we
that's-
learned something. I thought they did it to look pretty. 'Cause it does look good after they rake it.
So every time you see them turning over the sand, please know that that's a very
This
important
makes sense.
function, and it does more than make it look good.
Yeah, makes
And
sense.
the other thing is that we do post beaches. Our current sampling method, it takes 18 hours to get a result from that beach sample that we take. We send students out, they walk in, as you can see, up waist deep in waders, and then they have a grab sample at arm's length down into the water, so about a foot below the surface, 3 different points along the beach. And then they use some mathematical formulas to come up with a geometric mean, and then there's some criteria and standards that we follow. And if a beach exceeds a certain level on a daily basis or a certain level on a 30-day basis, that would be a reason to close the beach, and then we post it. We're excited because our laboratory is now testing using another method that will provide us the same day results, so that when we close the beach, it will be it'll be an accurate picture. Closing a beach the day after you've taken a sample is not a great thing, because it could be by today, the day after, the beach might be safe, and it's sad that we're having to close it based on those standards. But that is the current methodology. Oakland County is fortunate enough to be able to test this new methodology. In fact, we're providing more numbers to the EPA than any other single location in the country. And they're waiting on us to provide about at least 3 years worth of samples to decide if this is, because we're running both programs simultaneously, and so they can see how accurate this is, and then they'll make a decision about whether or not this will be accepted as standard practice, and then we can start utilizing that methodology instead of the one that makes us wait 18 hours. So you might think we close a lot of beaches, and as you can see here in 2016, only 12 beaches were closed, and in this year, 9 beaches were closed. And although those beaches may have been closed numerous times, some of them have heavy geese problems, some of them need more water movement. So it's not as many as you might think, and we do post those online. It is available, and the media is often questioning us about that, but that is our beach program. New to us this year is harmful algal blooms. We don't actually do the testing. I know that you probably remember the problem with the harmful algal bloom that happened in Lake Erie that impacted the Toledo water supply a few years ago. That was the first time we really started to realize the impact that these blooms can have. It is weather conditions that actually make a difference. A lot of sunlight day after day can really cause these things to bloom, and then they can produce a toxin. Sometimes it looks like paint, sometimes it looks like a sheen. It's really hard to educate the public on exactly what that looks like. It takes a trained eye a while to recognize what you're looking at. But it is something that does happen on our lakes, and DEQ and Oakland University have been doing some testing across the state of Michigan this year, and they aren't doing very many lakes. I think Oakland County had a very small number that they were testing, but they will respond to any citizen complaint and do a test. Unfortunately, it takes quite a bit of time to get a result back, of up to a week. And then they let us know what the results are, and then that's when we come in with the notification process. And we will notify via press release initially to let people know that we have our first lake with a reported harmful algal bloom, start to try to educate the community about what that looks like, and then we will go out to the lake and post. It's difficult because where do you post on a lake? The only place we really have been able to post this year is around public beaches, and around boat launches to let people know. But it's not like we know exactly where that water was tested, and nor does that matter, because if it's in one place, it can be in many places in a lake. So we just have to keep working with the homeowners around that lake and the users of that lake to make sure they know. It can cause some harmful health effects for both humans and pets, so we ask them to not swim in it, not drink it, not run. If you're running a hose out of a lake, to be careful with that and be cognizant of it. So this is new to us, and I'm sure that this will become a bigger issue in the future, and the health division will become more and more involved, and maybe eventually we'll be looking at doing our own testing here to make the process quicker.
Scary.
Other monitoring programs that are very important are the Type 2 public water supplies. We have 657 Type 2 water supplies, and I don't know if you know what those are.
I do.
You have
I'm one. Yeah,
You
I'm
have
one. Yep, Bob has
And
one, I have
it's
one.
basically, the vast majority of Type 2 water supplies are strip malls, restaurants, schools. You have to, it has to meet a certain criteria for the number of public that you serve with it and how the water is used. So we have the largest Type 2 water program in the state of Michigan, and we have to and every Type 2 water supply has to have a certified operator. We educate certified operators, we help certify them, and then we make sure they're following the sampling frequencies, and they sample quarterly. But Type 2 water supplies have they have a lot of requirements in terms of what they have to test for. So we're finding out a lot about our water and our aquifers through our Type 2 water supplies. They're testing for coliform, nitrates, VOCs, arsenic, and lead and copper. And then we finally have our maximum contaminant level program, and that is any citizen that comes to our counters and purchases either a bacteriological test bottle or what we call a partial chemical test bottle. And partial chemical tests for things like nitrate, nitrite, chloride, fluoride, and sulfate. Tells us a lot about that water supply. Sometimes we can tell from those results if it's been contaminated by sewage or a number of other things. So what you should know is that everyone that comes to the counter, and actually last year we had 5,200 samples that residents paid for. And we have a sanitarian. Once it goes through our laboratory for analysis, we have one sanitarian dedicated full-time to reading every single sample, making notes on every single sample, send it back to them, and they make a phone call to every single sample person that made that sample and try. If there was a problem found, they will call them, tell them what the problem is, educate them about what they need to do, guide them in resampling, and work with them until they find resolution to the problem. So that takes an extraordinary amount of time, but we're learning a lot about our aquifers and learn a lot about how to protect our aquifers through this program. Very important program. People also buy these bottles and run it through our lab if they have cottages, and they'll bring that water in, and that's fine,
That's
they pay a
good.
little bit higher price.
It's a good idea.
But we
So you don't
provide
use
the
it
same
once.
service for them as well. So, and then finally, you know, just to let you know that, with this money that was funded to MyCore, we intend to work closely with MyCore and communicate with each other, because when they're out on lakes, they may see things that might be early warning signals to us. They may see early warning signs for harmful algal blooms that we would want to know about and follow up with. They may see, if some of them may be testing for things like E. coli. If that's the case, we want to know what the results are. And sometimes they may see things where they see a very weedy situation and assume that it's fertilizer, but it might not be. Their tests may never show that there's a fertilizer present there. And so then we want to know that, because it could be a leaking septic system or a failing septic system, and we would want to work to try to do that. We do a lot of monitoring through complaints and observations that people make in the county, and we are able to track down a lot of contamination through those complaints and observations. So we're hoping that through MyCore, we're able to expand those opportunities. And that's it.
Okay, Commissioner Hoffman has a question,
I
then
have two
Commissioner
questions.
Taub.
One, you mentioned that somebody put a geothermal system in Troy and they drilled 75 wells. Is it because it was a big system, or they had some?
Very big system.
Okay, all that for that, wow.
Yeah.
Okay, next question, you mentioned where they put a municipal water system, some people wanna keep their well for irrigation.
Correct.
That you're saying they can't do that, or
No,
they
we're
can?
not saying they can't. We just
Okay.
try to educate them on, you know, you have to
So
be
that
very
people have
diligent in
further
keeping that
watering
well
the
up and
grass, they can do
maintaining
all
it, and not utilize it for drinking water in the future. But we just try to encourage them, if you're not gonna use it, get rid of it.
Okay, thank you. Good
Commi-
program.
Commissioner Taub.
Yes, I thank you, Kathy, for the presentation. I spoke I think it was last week or the week before, with someone from Lake Pro, and they do an awful lot of lake testing in Oakland County.
Yeah.
And in my district, and I said to them, do you test for things like coliform and stuff like that, whether it's geese or human or
Right,
septics
right.
or whatever? And they say that sometimes they do, sometimes they don't. Most often they do the request of the lake board or residents, depending on
Right.
who's running, taking care of the lake. And then I said to them, well, when you find this in a lake, what do you do? Is there a requirement for you to report to the health department? There is no requirement.
Right.
So I'm asking you, would it help you if, and I also asked them, would it be too burdensome for you to pick up the phone and call the health department and say, look, I'm on Jones Lake. I hope there's no Jones Lake in this county. But whatever lake, I'm on some lake and I found whatever I found.
Of course.
That would affect the health and welfare. And then he said, absolutely not. But they don't have anywhere to call. And
Oh,
it's-
really?
Well, they don't know about it.
Right.
So that's my problem. They are licensed by the state of Michigan, as you well know.
Mhm.
But we don't do anything here at Oakland County. We assume the state license is adequate for them to service lakes in the community, or in the county. So my question to you is there some way, would it help you to make it, do something to make sure that they will report stuff that could affect the health of the community or the lakes? Because as we were discussing with the Clinton River watershed and the Rouge, which I live on, the headwaters of,
Right.
what affects some lake up here is gonna affect some lake down there. So would that help you to have an ordinance of that sort?
Well, I'm not sure about an ordinance. Actually, that information would be valuable to us. So is it a case of people just don't know who to report that to, or they
It's a
need to
combination
be,
of, it's a combination of
required?
two things. One, some may not, okay, but the other thing, it's not a requirement, so therefore they take care of it themselves with whatever they do. But I'm thinking now about a particular community which will remain nameless in my district, where we've got a lot of septic leaching now, where there's no viable property to put anything in, so.
And
when you-
that's where it would be most valuable to us if it is a lake that does have homes with septic on it. Because sometimes they might be reporting to us geese. And, you know, we're gonna get the same results. Until we start using this new technology, we aren't going to be able to, that's the other advantage to it, is it will tell us, does it come from human, fowl, et cetera.
Whatever.
That's good.
Yeah, well, and I hear that, but would it help you if it was a mandate, if they had to report it to you, because then you could step right in, because you do not inspect, as I understand it, septics, unless you have a call from somebody and say,
Exactly right.
there's something going on, my lake is smelly, or something.
Exactly right, because in Oakland County, we do not have a point-of-sale program or a septic inspection program. We have no other opportunity than if it's complaint generated or someone's reporting a result to us.
Okay, so how do we make it, how do we make it mandatory that people call you? What kind of a program do you need set forth? Or how could we work with the DEQ or whoever licenses these people to do lake work? What do we do? I mean, what are your suggestions?
Well, maybe it starts with education, but I have no idea how many companies there are like that are doing testing on lakes in Oakland County lakes. There's a lot of Oakland County lakes. So,
well, if you had communication with the DEQ, okay, then they could tell you how many companies are licensed to work are licensed to do this work, and how many are working here, because they all, when you start to treat a lake, when you start to treat a private lake, you need a permit of some sort from the DEQ. So there you go. If there's any kind of communication with the state.
I've tried to get a state license.
Pardon me?
State license list before and have met with failure every
Well,
time.
I'm not saying license, I'm saying that they.
Don't change the law. She wanted to see.
They need a permit to
Yeah, we
take
can
care of
try
my
that.
lake or
We
your
can
lake.
try that.
She's saying she doing it.
That would be helpful.
But the
because-
problem here lies again, just because they have a permit to do the work they're doing on there, doesn't mean they're necessarily testing for what we wanna see.
Right.
Which means I would have to get, a lot of staff engaged with calling all these to see where are you testing, what are you testing, when are you testing?
But if they knew as part of working in Oakland
We
County.
could send a letter out to them.
Okay, if they knew as part of working in Oakland County,
Yeah,
if they find anything that's not
yeah,
whatever, that
Yeah.
they just pick up the phone and call your number and say, I'm on this lake,
yeah, we could do a letter campaign for that.
would that help?
We can try it.
Okay, the DEQ knows when they apply for permits. I think they have to apply for permits 90 days ahead of time or some type of thing, so I
Oh,
don't
well,
know.
that's the treat.
That's the treat.
That's the treat.
Treat.
Yeah, so they could be out there observing and testing. I don't believe they need any permit for that. They need a test, they need a permit to treat.
Tree, right.
Right.
Oh, yeah, but they wouldn't be
They
able to
also
write the
need a permit
test, so
to
you
work
don't
in
know.
the state as well.
Yeah, I'm not
Is that
sure.
on different lakes.
You might just
I
need a
remember
permit
needing
to break in.
$100 a
Just
lake.
because they're treating doesn't mean they're testing.
Right.
Okay. Got it. And if they test, we want to know what they find, if they find anything.
It's those
That's my
companies
point. So
treating
how do we
different
do
the
that?
chemicals is what she's talking about.
I don't know.
Testing, going to
I
spray and get
can
money
go
from
back
the
to
chemicals
environmental health and have
on
it
the
checked.
lakes, the
Okay.
private lakes,
Thank you.
you know. Commissioner Gershenson, then Commissioner Woodward.
Well, thank you, Kathy. This was really interesting to learn about the depth of this program. You cover so many different areas. And maybe we know that the educational component of this money for MyCorps is critical. So maybe with the use of social media, which we've learned in other projects we've been involved in, is so extensive, their reach is so extensive, but maybe somehow we can incorporate an educational piece that would even go to companies or our homeowners.
Right.
I mean, for me to learn that the sheen might be a symptom I'm very interested to learn more about what that looks like. Would I go to the DEQ to get more?
Yeah, there's a lot of different pictures. Unfortunately, there are so many different ways it can look. It's difficult for someone untrained to really know if that's a problem or not. And there were a lot of blooms this summer. Many of them completely harmless, but some of them not so harmless.
Well, I just wanted to thank you for what your department is doing, and also for your reaching out and collaborating with other organizations. I think there's plenty of work, it seems,
Yes, there is.
to go around. Thank you.
I have Commissioner Woodward, then Commissioner Kowal.
Thank you, Madam Chair. Yeah, no, I mean, I see this presentation. I continue to be amazed, like, all the work that the Health Division does, and then I look at how many people work there, and I'm like, I don't know how you all do all this, because, I mean, we're just talking about water. I
We
mean,
get every drop of work out of
Clearly, I mean, I get, well, and I sit on the Sanitary Appeals Board, which I'm convinced that I was set there because we don't have septic tanks in my neck of the wood. And I mean, how much I learned in that process. I mean, like and we usually only see the things that don't conform with the code that comes, before us, and then there was some state action that made it easier for the department to take action. But I mean, to see 757 septic tanks that, at an average, permits being pulled because they have to be replaced. I mean, we've got a lot of old septic tanks. We know this just based on the construction of the homes and where they're located, and the idea of human waste like seeping into the water table just gives me the heebie-jeebies. So, but one question I never asked, and I know they're very expensive. I mean, these are not cheap endeavors to undertake. But I mean, from a permitting process, and this I guess also related to wells. But I mean, what's the permit fee? Like, well, I mean, based on the frequency of inspection and all that work, and I see this in a lot of the fees that we charge that come nowhere near recovering the cost that it is to actually do this. For like a septic tank, like what is the?
Honestly, I don't know what it currently is, and there's different types of fees depending on if there's engineering required, because we will spend an inordinate amount of time working with the engineer, so it's going to be more expensive. But we charge nowhere near what our peer counties do, and nowhere near what our costs are.
Right.
Because we try to keep our permit fees low.
Right. Yeah. And I think that makes a lot of sense. I mean, at some point, however, based on
and
all this
actually
inspection
we are
and all.
Revisiting them right
Yeah.
now.
Oh, that's good to know. Good to know. Because particularly, state minimum 10% be on site to observe what's happening, and we're close to 100%. That's good.
Yeah,
And it comes with a cost, and because of like so many lakes that we have here, I think protecting the water table and protecting the lakes is important. Related to the septic stuff, and you mentioned that we don't have a septic monitoring system, and I guess is that a policy decision? Is it just like we just don't have the manpower and the resources to be able to do it? Are there counties that are requiring some sort of regular inspection? Because I know that when the appeal thing, when we make a consideration or allow for a septic tank that doesn't conform to code based on usually in replacement of existing ones, that we put, I don't know if it's de-restriction is the word, but it's inserted like, oh, by the way, you're responsible for maintaining this thing when you buy this property in the future. Whether people read that or not, I don't know, but we at least try to make people aware of it. I guess, what is the conversation going on about, like, maybe getting to a place that over a period of time that we have we know that maintenance, increases the duration of these things. And no one wants these things seeping into the lake. But, there's a cost to that. So what's the thought of the department right now on a macro level on like some sort of regular monitoring of septic tanks?
Well, over the years, we've had a lot of conversations, the commissioners have had a lot of conversations, the state of Michigan has had a lot of work being done about what we're gonna do on a statewide basis and a local basis. Many counties around us do have point-of-sale programs where at the time of sale, it's required that your system is inspected. Real estate, sometimes they're really for it and sometimes they're really against it because it can hold up a sale. And I understand that, and there's considerable money that can come into play if it's deemed that a septic system is failing. We do know when we had the Southfield project and we were, had a sanitarian assigned to the city of Southfield per court order, to check every single septic system in the city of Southfield. And you wouldn't think there were that many, but there were quite a few. We had in excess of, I think, a 25% failure rate, could be more. This
And that
will
was by court
generate,
order?
that was
by court?
yeah.
Because of some detected leak that was happening, or?
Yeah, and you know what, that's kind of a little bit before my
Okay.
time, and, yeah, and I think it was determined that there were
was a
leaking
problem.
septic systems and contaminating the Rouge, I believe it was. We
Mm.
did a lot of work along the Rouge, and then we did have an inspection program, full-time sanitarian just for Southfield, and that was a very, very tough program. And I have to say that that's one way of doing it. The other way that's been talked about, and I thought a number of years ago was going to pass in Oakland County, become a new article to the sanitary code, would be to inspect all of our septic systems over a period of a 5-year cycle. With more than 80,000 septic systems, that is not only a tremendous burden for inspection, but that identifying a criteria for what constitutes failure. In the city of Southfield, they would pump the tank, and if there was backflow from the field, that was deemed a failure, and yet it maybe wasn't failing inside the house or surfacing to the ground. In other locations, it requires surfacing to the ground. Doesn't mean the septic system isn't failing though, and leaching into a lake or a stream nearby. Those are all very difficult questions that are hard to overcome, which is why the state has never been able to pass a statewide code for this. Some counties have decided to do, whether it be inspecting every system over a period of time, and consider they have far less septic systems than we do. Or they do a point of sale. They've enlisted third-party inspectors. And I can tell you firsthand, there's problems with that. And especially who's doing the inspections. Do they have a bias, or are they motivated by a company that they own that could benefit from that service?
Yeah, no, I've heard about that, and I asked, I mean, when I've asked the questions about that specifically, like the person who's doing the testing, are they barred from doing work on that septic tank?
Yeah,
and
so,
and how do you get,
sometimes
how do you
they
get
are,
enforce
but
that?
honestly, when you dig into it, they really aren't, so.
Got it. No.
Those are all hard questions, and yes, it is important that we do have functioning septic systems. It's really important with these engineered systems that are going in over the past decade. Those are complicated systems that need a lot of maintenance. And they agree to that maintenance, but do they do it? That's unknown over time. And then you're talking about a whole nother crew that we would need in the health division.
Right.
So it's all difficult.
No, well, I'm glad you're on top of it. And then, I mean, I guess one last question, right, algae blooms.
Commissioner Kowal, then Commissioner Hoffman.
Sorry.
No, you're
Oh,
good.
I mean, like, so the DQ came in, did random I mean, did they have an idea, were they looking for something? Is there an algae
don't
bloom
know.
under the earth that's like moving around? I mean,
We don't know.
we don't know.
We found out after the fact, we weren't pre-notified, and I'm working with others at MDHHS about this, that they weren't notified either in their environmental team. So we have to tighten up our communication so that we're working together and not appearing to work in silos.
Clearly they are. No, so no. Okay, so I was asking, like, what was the criteria for selecting what lake? So we don't know, and that's.
We're working on that hard this winter.
Got it. All right.
Okay.
Thank you for all the work.
All set?
Yep.
Commissioner Kowal, and then Commissioner Hoffman.
Thank you, Madam Chair, and thank you for your presentation. I have two questions. I just kind of want to follow up on the septic, then I have another one after that. there's just two of us living in our house anymore, but we regularly have our septic pump.
Yes,
And at that point, of course, we have the guy who does it, you know, inspects the tank, lets
Right.
us know what condition it's in. Is there something we could do through requirements like that? Because, I mean, some people will just go forever and not ever have a pump. So-
well, and that is very good. That's a responsible homeowner that's pumping their tank and getting advice from their person
do
that's
all the
pumping.
time.
Because
We
they
get so many
are
people.
experts. But just because you're getting a tank pump doesn't mean you're heeding the advice of the person that's out there observing firsthand. So we do a lot of education in communities about getting your tanks pumped, but we know that you're right. Many don't. Out of sight, out of mind, especially people that move from your neck of the woods.
To the country.
I have a septic.
I've been flushing everything down that toilet.
Well, they just aren't accustomed to growing up with that, and it's all new to them.
That's right.
And they may not be adequately educated when they move
right.
into that home, and that is a big lack.
Yep.
And I think that there's a lot
That's
of
true.
need there. We do our best to try to get information in their hands, but I know that there's many that doesn't happen.
Lastly, I guess, I know it comes under the auspices of the Water Resources Commissioner, and that's the soil erosion.
Yeah.
It also affects water quality. Do you coordinate with them on that issue at all? I
From
mean,
time
they
to-
do it and some locals do it too.
Right,
the permitting.
right. From time to time, depending on issues that might come up, yes, there is a lot of cross communication on different issues.
Okay. Thank you.
Okay, Commissioner Hoffman.
What's the average life expectancy of a septic system if you maintain it? I know there's a lot of variables, but if you maintain it properly and have it pumped every so many years based on the number of people in the
I
home,
think we have ours once a year.
what can you expect a septic system to last?
We always used to say the rule of thumb was 13 to 15 years. The better you maintain it, you can get years after that. And an engineered system, if you maintain it well, will last a long time because it really cleans up the effluent, doesn't have some of the problems another system might have in terms of filtering into the ground, but other components can break down. It really all depends on so many factors. Heavy use, I mean, this is another problem, you know. We have some homes in Oakland County that are incredibly large that are on septic systems. Septic systems are sized based on number of bedrooms. They have a big party that fills a 45,000 square foot home, and yes, we have one, and it can blow the system out of the water. And literally. And so.
Blow the subject out, literally.
Wow.
And, so we always educate them to, you know, bring porta
That's
potties
weird
on
though,
site.
they
Don't
can
use
have that big
your-
expensive
your
house with the
bathrooms.
septic though.
But it
I swear it
depends on
is.
your use. I mean, and also, we have a lot of problems with people using, to be quite frank, you can kill the biology in that tank. People on chemo, people taking certain medications.
Water softeners.
Water yes, should never have a water softener going
Pumped
into
into
a
your
septic tank. Also, people that are using new products never used before. Toilet paper in many areas, people are using more and more other products other than toilet paper that will clog
Yeah.
up a septic system rapidly. We just had a few years ago a very large home with a very large septic system that was belly up in 2 years because
Wow.
of different products they were using. So it's a
Then they
so
probably mandated
many
him
variables.
engineered
It's
new
very
fuel.
hard to
Go to
predict.
you.
Thank you.
Okay, good. Any other questions? Oh, thank you, Kathy. That was very
Thanks, Kathy.
informative. Thank you.
Could I borrow you for one?
Copy of,
Yes, absolutely. One last thing, I know I
Okay.
missed public comment, but please get your flu shots.
Okay.
This year, more than
I know, that's what I had to
this
go
is
to
going to
take
be
care
a
of this.
difficult year. I don't know if you've seen on the news.
Yeah.
When we look at the southern hemisphere, who always precedes us, they had a brutal year. A lot of H3N2, which usually produces the really bad kind of flu, we already have numbers of people hospitalized.
Oh.
This is very
They told me
early.
don't have to irritate
Very
them, too.
seriously
Be
ill
afraid.
people. Please recommend people around you get it. Even people that think they don't get it, ever get the flu, or if I do, it's so mild, I don't need a flu shot. You're not just getting it for yourself. You're
Right.
getting it for the people around you. It might not be life-threatening to you, but someone you come in contact with, it could be a death sentence for them. And so we have to remember that. It is very, very, very important. In the health division, we have a number of, we were able to get a hold of a number of high-dose vaccinations for people over 65. You get a better immune response from that, but there's not a lot of that to go around. When we checked around into pharmacies, we're not seeing them carrying it. If you have an elderly person, please get them to Oakland
okay.
County Health
Maybe a
Division
different dose,
as
huh?
quickly as possible, because I anticipate we will run out.
Okay, I have Commissioner Woodward and then Gershenson.
So, are we doing, I mean, I know we're off topic here, but, are we doing, like, flu shot events throughout the county? I know that, I mean,
We
might
do.
have to go to the farmer's market, we've done it there before, I don't know if that's on tap
We do a lot of outreach events, but I have to tell you, this year, we didn't have as many takers as we have in the past. We are doing, Troy, I believe we're doing Troy, I believe we're doing, Farmington Caustic, and I believe we're doing OPC. I think we're still working out those details. And we certainly go around to high-risk places and give flu shots. And we can be open to more. If we have the staffing for it, we certainly will take it out, and always willing to do that.
Commissioner Gershenson.
Well, just a reminder to commissioners, I went out of the country last month and Oakland County Health Department didn't start the flu shots, and it was recommended that I have one. So I just went to a local pharmacy, and it is not covered on our insurance.
It's not, it should
By
be.
law, it is. Obamacare.
Only through the health department or through your doctor's office. I went to a pharmacy. And they did not cover it, and I honestly, I had no idea.
That pharmacy was just not accepting it because it will cover it.
Yeah, 'cause I
Well,
think they said $20
our
flu shots
prescription
places. I see
coverage
those
doesn't
signs.
accept it at a pharmacy. So I'm just, I didn't know that, but, normally I get it through the health
That's,
department, and
I
I
saw
do announce
$20
it in my
signs.
communities.
Yeah.
So that's a good thing we can do too.
I thought CVS said it was $20 or something, $20. I mean, I saw signs saying $20. Oh, that's if your insurance, okay.
Oh, okay.
All right, because I see a bunch of signs everywhere by Walgreens coming for flu shot and stuff. Commissioner Hoffman.
Can we just walk in the health department then and get and our insurance covers that?
Yes, and, well, actually, you're covered by Oakland County Employee Benefits Program, which there's no fee at all.
Oh, so we should go to the health
Yeah,
department
I'm
probably.
going there,
It's probably.
You just walk in during the day?
Yeah, we officially open tomorrow. Our clinic opens today at noon. Our flu shot program officially starts tomorrow.
So
If you
wait
go
till
there
tomorrow.
today, I guarantee you can get a shot.
Really?
They'll
Just
be-
walk on.
Tell them Kathy sent you.
Yeah, they do a good job there.
Yeah, well, you don't even have to go to the monitor. We have a
Oh, yeah,
special,
okay.
we have a person stationed
Perfect,
there,
yeah.
right at the front that will take care of all your
Right.
It's
paperwork.
right over
Oh,
here.
yeah.
Yep,
Oh, okay.
Health department.
As we're talking about that, everyone do your open enrollment. It's due.
Yeah.
yeah.
If you didn't do
Right,
it,
do the
yeah,
water
Wednesday.
test.
Yeah, he just brought, Mike just
Yeah,
mentioned that.
check in the front desk,
Make
they'll
sure.
tell you what to do.
Okay, I'm going there.
All right, thank you, Kathy. We just
Thank
need
you
a,
very
I
much.
guess we'll do a motion to receive and file the
So moved.
presentation. Moved by Commissioner Hoffman, supported by Commissioner Taub. All in favor? Aye. Opposed? And then we need a motion to receive and file the communications.
What are we gonna do
Moved by Kowal.
Chris's communication?
Well, I would.
We'll move them first,
Okay,
move it, and then
I'll
we'll
do
say,
that.
okay, and then,
We'll discuss.
and then Commissioner Taub.
I think we should look into this. It is my personal opinion that if we have someone who is qualified from this county, we are using taxpayers' dollars to give mileage to most organization groups, and sometimes a stipend. And since some of these are silent, when they're silent, there's no law. I think should have corporate counsel look into it and see
Yeah, we
if we
could.
can say in our board rules Obviously, if they want people, and there's nobody qualified from Oakland County, I have no problem with appointing a qualified person from someplace else, but I think we need to look within 1,200,000 people, we ought to be able to find somebody.
I have a question.
Yeah.
How would
Commissioner
that
Hoffman.
work then in the solid waste committee where you have a representative of Republic Waste whose office might be in Oakland County, but they
Right.
live in who knows?
Well, that's what I
where?
just said, Bob. If there's nobody qualified from the county and there's a specific qualification they need, fine.
Oh,
go
then we
ahead,
do
yeah.
that from the
Yeah.
industry or whatever,
Right,
okay.
whatever,
All right.
exactly, exactly.
So you
I
you
agree.
want corporation council to,
I don't know if it goes through email, because
is that okay?
But I guess,
Chris?
well, my question is like, what are they looking into?
Yeah, if it-
Whether-
for the
Whether we
silent
can?
committees.
I mean, we certainly can.
Yeah, that can be
Look at
accounted.
The requirements under statutory on this list,
I saw it.
they're silent. So I would like to have a board rule somewhere that says when at all possible, in other words, when we are going to look for Oakland County residents to serve on all of our committees. We're using taxpayers' resources and oftentimes funding, I can't speak much longer, pardon, for this.
So, yeah, I mean,
Yeah.
I understand the intent. I mean, can't we just ask staff to draft that?
Yeah. A
I mean, I don't
resolution.
know, I mean, corporation council is gonna say, you're
Right.
right, you don't have to.
Yeah, I think, can we do a resolution, just a board
Well, I asked
resolution?
for
Or-
a resolution originally, but this is what,
Do we need corporation, I don't understand what we need corporation council to do. I mean, we clearly have the authority to require such a thing.
I'm not 100% sure you can create it.
Oh, well, never mind.
All right,
Okay.
well then, have Chris work on it, and then we can just
Got it.
receive and file the information.
I got it, that's fine.
Are we
No,
good?
I got it,
Let's do a
okay,
voice-
that makes
let's
sense.
do a voice
Well,
vote. Oh,
well, and just like one
okay,
other
you wanna
thing
ask-
is that I see,
Oh, you want something else on there?
some things are statutory.
yeah, no, so item A, I'm gonna shift topics, that I see Genesee County
Oh.
is informing us of their opposition of slashing federal fund for the Great Lakes Restoration Initiative.
Oh.
We have that resolution sitting in our committee.
This one?
Oh, yeah. That's it.
Okay.
Okay.
I just,
remember
hey, Genesee County beat us to the punch.
Yeah, okay, so let's do a
Yes.
voice vote on the communication. All in favor, receive and file. I
This
think,
one right here?
Yeah.
Dave seconded, so voice.
I'll double check.
Yeah, all in favor?
Aye.
Aye, opposed. Any other business? Oh, everyone's gotta go. We're adjourned.
Yay.